Hello and welcome, everybody. I'm very pleased to be introducing Dr. Frances Yarlett, who you might have, if you went on to our clinic, it was last month, a few weeks ago, wasn't it? Our gynae clinic. You were very kindly one of our panelists, and I know we had a lot of questions and all of those things. So welcome, Frances. Do you prefer to be called Fran or Frances?
Either. Frances is my Sunday name. But Fran I go by most often at work, so Fran is fine.
Your Sunday name?
Mainly from my granny.
Oh, that's a nice way, as opposed to when you're in trouble name, which is quite often.
It's never in trouble.
So, Frances, before we launch into talking about contraception and all the different types of contraception, and I know that we've got a big interest in our audience, or rather our membership, because we've done quite a bit on contraception recently, and it's quite interesting, all the different reasons why people take contraception. So, but before we launch into that, please, can you give us a bit of background, about yourself and where your interest comes from?
Yeah, of course. So Dr. Frances Yarlett, I am a GP by trade, and I work in Sheffield in South Yorkshire. And I also work as medical director for a company called The Lowdown, which is an online contraceptive platform helping women to sort of navigate the minefield that is contraception, being able to look at reviews and access extra support from myself and the other doctors. And I'm also an ambassador for the Family Planning Association, which you may have heard of, who are a big name for the last 100 years in birth control and sexual health. And then the hardest job I have is being a mum to my 8-month-old baby who's next door and hopefully won't be coming in unless there's an absolute emergency. But my interest in contraception, I think, mainly comes from the fact that I am a young woman myself, and it's something I've had to navigate. It's something that I speak to a lot of my friends about, and so I really feel like I can make a difference to the patients I speak to from my own lived experience of it.
Definitely. And I think it certainly helps a lot of women if they go to their GP and there's they see, I was going to say a woman there as well, of the same age roughly and having the same issues, because it is nice to have somebody to empathize with the issues that you experience. And I suppose that could be said across the board in many ways, and I certainly don't mean that as a slight against any male doctors, for sure. But looking at contraception, it's obviously, I suppose it was revolutionized by the pill, but things have changed so much. When I was young, you just went on a pill, you never questioned it. And that was it. So tell us how you think it's changed over the years.
Well, it's funny because I often get quite frustrated because I feel that it's not changing enough anymore in the last few years. But then if you sit down and think about it and actually look at the timeline, it has vastly changed since the 60s. Before the 60s, women essentially had nothing. There was condoms, which were available from about the 15th century. This is when the first time it was in medical literature, talking about a linen sheath to prevent syphilis, which I found quite funny, rather than prevent pregnancy. But then from then until the 20th century, there was very little that women could use. One of my favourites was the injection method, which was in the United States. Women used to inject a combination of salt, chloride, and vinegar inside themselves after sex to try and prevent them getting pregnant.
Oh my goodness.
I know. So when the 60s came along and we finally understood how the reproductive cycle works and how women get pregnant, and the combined pill came along, it was really revolutionary. Since then, in the 70s, the copper coil came about, which was one of the first what we call long-acting forms of contraception. And then in the next decade, the 80s, we had the contraceptive implant. And then we've had a whole flurry of different options, including the injection, like a multitude of brands of the pill, where the hormones are all different ratios and different types of the progestogen. And then we've had the hormonal coil, which has been another huge advance in contraceptive health up until this period, which now makes it really difficult for women because you have almost so much choice that you can't just be put on the pill. It really takes a while to think about your decision.
And what are the sort of, the main types of contraception? Because it is obviously, it's not just all pill. There's a whole range of pills, as you just said, but there's also other types as well to consider.
Yeah, and I suppose the types, you can break it down quite easily into firstly hormonal and non-hormonal. So the hormonal types use hormones. So the biggest example of that being the pill. And when women say the pill, what they usually mean is the combined pill. Combined because it contains two hormones combined together, estrogen and progestogen. But then we also have progestogen only types of contraception, and that includes the mini pill, the injection, the implant, the hormonal coil. So they are the hormonal options. Then we have non-hormonal options. So the copper coil, barrier methods, including condoms or cervical caps or diaphragms, and then also one of the most old-fashioned methods, which is fertility awareness or the rhythm method. More recently, another massive advance being brought into the digital age, you can now use fertility awareness methods using an app on your phone. So that's the two main methods, but then we can also break it down into longer acting and shorter acting methods of contraception. So short acting, ones that you sort of have to think about more regularly and more often. For example, the pill that you have to take every day, or almost every day, because you can have a break with some to make it effective. Condoms and other barrier methods are short term because you have to use one for each time that you have sex. But then the long acting methods are ones, I love the phrase fit and forget. So you can just put them in or have an injection, and then that's it. You can forget about them for a few months, if not years. So that's how we separate the types of contraception. But of course, within that, there is different options themselves. So you have non-hormonal, hormonal, long-acting and short-acting. And that's how we tend to divide them up.
Right. And then, so, it sounds like a minefield. How do you know what's best for you? Is that something that you should go and discuss? Where do you start?
That's a really good question. Where do you start? And I actually strongly believe that you should start when you're very young. So really, before you're even thinking about going on a contraceptive, you should be educated about it in school. Because without education, how do women know where to start? So it starts in school. And then when you get to the time in your reproductive life as a young woman or man, because men need to think about it as well, I always think it's a good idea to gather as much information before you start thinking about a choice. So we're lucky these days, we have the internet, and online there are some fantastic resources, including on the Lowdown, our website, and then Sexwise is another excellent website where they have tools that can help recommend a method for you. So if you fill it in, it will ask you certain questions such as, what's your lifestyle like? Would you remember to take something every day or not? How do you feel about this? Do you want hormones or not? And then that will give you a recommendation, which is a guide of where you can start reading into things. And so I would say take that step, read into some of the methods you like the look of, and then take that information with you and go and discuss it with a healthcare professional. I think that's really, really important because it's not a simple decision, it's not an easy decision, and there are things that are important to you as a woman and as a patient, but there are also things that are important to us as healthcare professionals about your medical history that we need to look into, both of us, and then agree on the right choice for you.
And would you say the first step would be to a GP, or and it used to be family planning clinics. I don't know if they still have those, or
they do, but unfortunately there have been vast cuts in the sexual health and family planning sort of budget, so it's not quite as accessible. GPs still do a huge amount of contraceptive work, and actually one of the public health studies in 2018, women prefer to see their GP because we tend to be more accessible, although I do know that people spend a lot of time on the phones at the moment. So a GP is a fantastic place to go. If not, there should be a local sexual health clinic in your nearest town and city, and you can find that online on the NHS website where it is.
I think years ago, when we all had our own dedicated doctor, which seems like a long time ago, and so there was always that pressure when you were younger that you didn't want your family doctor to know. And I suppose a lot of that has gone, hopefully a lot of that is one of the positives of not necessarily having your own dedicated doctor. You can see other people, really.
I'd really hope that's not the case anymore. I mean, number one, it's all confidential. You cannot discuss. So say, for example, if a 16-year-old girl wanted to go and discuss contraception but didn't want her mum to find out, as long as that 16-year-old girl is sensible, competent, and is not coming to any harm, the doctor does not tell anybody. It's
what I meant is that it's the perception of a young person, is that concern. Something would be said. I'm absolutely not questioning whether a doctor would portray any kind of confidence, but it's
but I agree with the perception, because I think for our generations it was more stigmatized, and people didn't really want to go and talk about it or have other people know that you might be having a sexual relationship. So there is that fear sometimes of people going to discuss it, and I think culturally that can be very different as well in different cultures, and we need to be very sensitive of that for different women who come and speak to us. But I'd always say to women, please don't be worried. We are very approachable, most of us, and we want you to come and talk to us. I can understand why that fear has been there, but I think that's changing. It's definitely changing. We talk about it more on social media, things like that, so younger women have more access to it.
Just before we go down, because by default we end up talking about women, and as you said earlier, it's absolutely a male's, has to be as responsible or aware as well. So it's, what would you say? I mean, before we go down talking about the women and different options, for a man, what would you say? If I've got a son and I'm thinking, well, what would I want him to do? Would I send him to I don't know if you'd send him to the doctors or you just say condoms, but what are the choices for a bloke other than condoms?
Well, there's condoms. There's also vasectomy, but then you've got two extremes for men at the moment. You have condoms, which aren't the most effective method. They're very good at preventing STIs, which is something we are very thankful for with condoms. But then the other end, you have vasectomy, which is it's not readily reversible. It's a more permanent form of contraception. So men are stuck in the middle where they don't really have anything at the moment. Luckily, there is research ongoing, but we think it's probably another 10 years until we have a really good male reversible contraceptive, which is probably going to be an injection or a gel, possibly a pill, but that's quite a way away. So I think if you have a son, what you want to be doing is, again, educating your son about the importance of contraception. So when they are entering into sexual relationships, they are responsible and they are empathetic to their female partners and have an understanding of what they're having to go through to discuss and choose and take a contraceptive to prevent the pregnancy.
Absolutely, and it's behaving responsibly, isn't it? And learning to grow up with the consequences of your actions as you get older.
And I actually think if any parents are thinking about having these conversations with young adult children, the Family Planning Association has got some excellent resources about how you can have those conversations with your children. But I completely agree. It's just as important for men to understand contraception as it is for women. And you could perhaps gently persuade them, if they have a long-term girlfriend, why don't you go to the doctors with them and learn about what they're having to do? Which I don't see often, sadly, but I would like to see more couples together.
Definitely. So once you kind of what's best for you, which is you discuss that with your doctor, and of course, as you said, you can't work out necessarily yourself based on the type, what your previous health history may be. So then what are the sort of the benefit, one type has some certain benefits, and then I'm sure it's counterbalanced by the risks on another.
And this really is why it is a minefield. There's so many different factors in a contraceptive choice. And for me, as a doctor, the first and foremost is what is the safest for you. And I want to explain a little bit about how we do that. So we have a document called the UK Medical Eligibility Criteria for Contraception. It's 175 pages of medical conditions and the risks that are associated with different contraceptives. But risk is often quite difficult to explain, because when we think about contraception, we are only ever comparing the risk of that contraceptive with the risk of an unplanned pregnancy. So pregnancy is a dangerous thing, and not only physically for some women, but also the mental health aspect of an unplanned pregnancy can be huge. So when we look at risk, there's a few popular ones that, or not popular, but ones that come up quite a lot. One being blood clots, and that's been in the news quite a lot recently, especially in association with the COVID vaccination.
Yes.
And we have to think about the risk of women with blood clots with the combined pill, because it does increase slightly. So combined pill users have a 5 to 7 out of every 10,000 women per year would have a blood clot. And that sounds really quite scary to some women. If you change your pill type, that can go up even a little bit more to 9 to 12 in 10,000 women. But if we compare that to a woman being pregnant, that risk is actually almost 30 out of 10,000 per women, 10,000 women per year. And then after you've had a baby, it shoots all the way up to about 300 per 10,000.
Oh my goodness.
Yeah, so risk is really difficult to talk about. And when you explain it like that and have the time to explain it, you sort of recognise that, yes, there is a risk of the combined pill. It increases my risk of blood clots, but it only increases it slightly, and it is still less than the increased risk of being pregnant. And this is why healthcare professionals need to be involved in the conversation to discuss these risks, to allow a woman to understand them and to evaluate and judge them based on what she's willing to accept. So blood clots is just one example. And the other ones that come up quite a lot is breast cancer. If I use the pill, I could get breast cancer. But for example, for every, I think it's between the ages of 50 and 59. Yeah, 50 and 59 per 1,000 women. Of those who've used the combined pill, there's only an extra 4 cases per year of breast cancer. If you compare that with drinking alcohol, either more than 2 units a day, that goes up to 5 more cases a year. But if you compare that with being overweight or obese with a BMI over 30, that goes up to 24 cases per year.
Gosh, and that's why figures, it's great to have figures, but you have to put them in context and in comparison, don't you?
Exactly, yes. So they are the regular risks that women ask me about. They are very worried about blood clot risk. They're very worried about breast cancer risk. But explaining it in that way gives it some more context. But then we also have to find out about a woman's past medical history, because there are specific things which can increase your risk even more, to the point where we say, well, actually, it's less risky for you to have an unplanned pregnancy than it is to take the pill. So we wouldn't give it you. And that's why we have this 175-page document, because there are all sorts of medical problems we need to check against, including heart problems, liver problems, gallstones, specific cancers, neurological conditions, clotting disorders. There's a whole range. And so that's why if you're not a young, fit person with no medical history, you should always speak to a healthcare professional when choosing contraception.
And then, of course, the flip side is the benefits, because what we haven't spoken about, apart from obviously not having an unwanted baby, are all the other benefits which we know. And I was really surprised that, it wasn't necessary. When I said it's not the number one reason why people go on to contraception, but it's just what, not having a baby was just one of the many things.
And that is really, really important to talk about as well, because we get bogged down with risks. But actually, the benefits of contraception, for the individual woman, contraception is a treatment for acne. So we can use it to treat acne in young women. It helps with heavy, painful periods. And this is almost all forms of contraception, not just the pill. It can help with PMS. It can help with polycystic ovary syndrome symptoms. It can help with endometriosis symptoms. It's the combined pill itself is actually preventative and can reduce your risk of other cancers like womb cancer, colon cancer, and ovarian cancer, which often you don't realise. And then not only that, as you go through your reproductive sort of life, as you get towards the perimenopause and menopause, the hormonal coil is the #1 treatment for heavy periods related with the perimenopause. And then it can even be used as part of HRT to treat your symptoms as they're ongoing. So the benefits to the individual woman can be brilliant. And then I get quite philosophical at this point, and I think about the benefits to society of contraception. So if you look at how the gender inequality has changed over the last century, I think part of that has been a huge amount the fact that women have been able to choose when to have a family. And giving that choice has allowed women to progress in their careers and is really sort of bringing things together with the gender gap. Not only that, if you look at elsewhere in the world, having contraception and reducing number of pregnancies is a huge determinant of poverty. And then if we look into the future, climate change, we need to be able to control the population to prevent climate change, and contraception is one of, well, really it's the #1 way to do that. So benefits, individual woman, and then society as a whole, huge benefit.
Funny enough, roughly this time last year, maybe in May, we had Dr. Rebecca Folgy, and amazing, and exactly along the same lines, looking at it as the bigger context and how important it is, and how important it is that we educate children as early as possible to take responsibility on so many fronts, from the health and the sexual side of it, and world population.
Yeah, as I was saying, you've got to start young with the education.
And I know I've said it before, but I think that, the older one gets, you forget actually how bright children are and how they take on stuff. And I think, especially with all the environmental stuff, children are so well aware now of what's going on. They want to be part of it. They take responsibility. When I was younger, God, that was for the grown-ups. I don't think for a lot of children, they are part of this world now. It's not for grown-ups, it's for everybody to be aware of what's going on.
I was always taught at school from my favourite netball coach, knowledge is power. She was talking about the rules of netball, but it's the same with everything. Knowledge is power. And the more that we teach and educate our young people, then the better society is as a whole.
And I think also because, knowledge is power, but knowledge gives you a choice. And that's what we're talking about with contraception as well. There is a choice. You don't need to have a child at a particular time, and it's understanding when to plan and when it works for everybody.
And that's why it's so vital, and really is an essential part of healthcare.
So once you've gone through all the mathematical juggling of the pros and the cons, it sounds quite tricky, but thank goodness that there's family planning, there's your doctor and everyone to guide you through. And of course, obviously, one of the things is that what you may start off with, it is also then trial and error as to whether it suits you, because the next thing I was going to go and talk to you was about side effects.
So side effects, traditionally, I feel that when you went to an appointment to discuss contraception, it was, this is how it works, this is how you take it, this is what you do if it goes wrong, these are the urgent things you need to tell us about. For example, signs and symptoms of a blood clot, severe headaches, things like that. But in the 10-minute GP consultation, there's rarely enough time to then go into the minutiae about how these extra hormones or non-hormonal methods may affect your body. So I don't think side effects get discussed nearly enough as they should do, which is a big part of my work with the lowdown, is that we're trying to encourage women to review and report their side effects so other women can learn from their experiences. So, for example, bleeding is a very, very common and annoying side effect, particularly for progestogen-only types of contraception. By that, I mean the mini pill, injection, implant, hormonal coil. You can be a lucky woman and not bleed at all for the entire time that you use it. Or you could be one of the 10 to 20% of women who get unpredictable, annoying, really long periods. And that's very frustrating for some women who this could be the only method that they can use due to their medical history, and yet they're stuck with this really annoying side effect of bleeding all the time. And because it doesn't get discussed often, women either think there's something wrong and get very worried, or they don't know what to do about it. But we do have tricks that we can help with. We can change things around a little bit with the type of hormone, or we can do things that are more off license, so aren't technically how the medication is going to be prescribed, but we can suggest women take things in a different way to help their side effects. So bleeding is a very common one, and we know quite a lot about the bleeding because it's easy to research. Other side effects that are sort of more soft, so for example, I just don't feel right, I feel like I'm a little bit flatter, or my libido has gone, or I feel a bit dry down below, are often really not talked about very much at all, and are more difficult for us to research, so we don't actually have any data on it. So I'm really passionate about trying to make sure women understand these side effects and what they can do about it, and to look out for them. Because at the end of the day, women are intelligent enough to weigh up the pros and cons of some side effects and the benefit of the contraception and make the choice for themselves. But we shouldn't downplay the side effects and pretend that they don't happen.
And with the side effect, how long, so I've started a new, I'm on a new pill for whatever reason. How long does it take for it to sort of settle in, and how long do you put up with side effects,
So it's really funny because there's a 3-month rule. We've written a blog about it on the lowdown. It's such an arbitrary number, 3 months. Why? And that's because we think from research that's how long it takes for things to settle down in your body. But how even the copper coil, which is non-hormonal, we say 6 months for that, for your periods to potentially settle. But I have a different view on it. I say, yes, if you can try and push through these side effects for up to 3 months, things might get better. If they don't get better, why are you living with it and being miserable? Or if after 2 weeks you are so miserable you cannot continue with this, then come back and speak to a healthcare professional about it. It's very individual. And I also think that if you explain the side effects to women and what they're looking out for, they either, you can look out for them so much that you arbitrarily feel them when you aren't really having them, or if you're mindful of the side effects and you recognize it, you can go, oh, don't worry, that's the contraception, it should get better, and then keep taking it. So, but that's why women need to be aware.
Did you mention about how contraception can be very helpful for PMT type of things?
Yeah, so especially if you take it in different ways. So because the main way hormonal contraception works, other than the hormonal coil, is it prevents your body ovulating, so you don't release an egg every month. So very briefly, the hormones in your cycle are peaking and troughing throughout your menstrual cycle. If we stop that ovulation, we can steady them out, and so therefore you're not going to get the swings in hormones which can cause those PMS or PMT symptoms. And we can improve those even more by taking the pill, so the combined pill, in a more modern way. Sort of my mum's generation were always taught, you have a packet, then you have a week break. Packet, week break. But we now know that week break is actually completely unnecessary. And by getting rid of the break and just taking the pill every day continuously, you can help improve a lot of those side effects by stopping the slumping of the hormones when you have the break.
Yeah, because that is totally inbuilt into me.
Yeah,
for sure.
yeah. But it's one of the tips, and it's talking about it. So there's the knowledge that side effects can be improved by different things. Ideally, I would love when a woman has a prescription for something like the pill or the implant or the injection, they also have a little pack with them with other things that can help deal with the side effects. And one of the biggest ones I hear about a lot from my work with the lowdown is the impact that women think contraception has on their sex life, which you think is sort of counterintuitive because you're using the contraception to have a safe sex life, but then you feel like the contraception is affecting it detrimentally. So what can we do about that? And I was actually thinking about this last night. It might be very off topic, but I'm going to talk about it. No one talks about the vaginal dryness associated with contraception, which is actually, it's a really common problem. And it can be really awful for women trying to maintain their relationship and their sex life with awful vaginal dryness symptoms. And I was thinking, why do we all moisturize our face and our body so much? And there's so much advertising, and yet it's so taboo to talk about moisturizing your vagina and vulva. So that's one thing that I think really should be pushed for women, is actually vaginal vulval health is so important. Let's talk about it alongside screening for breast and cervical cancer, contraception, and vaginal and vulval health at the same time.
We did a webinar around dermatology below the waistline, and the amount of agonies that people go through because they're first of all so embarrassed to go and talk to a GP about it.
Yeah, and it shouldn't be, because if you go to speak to a female GP, it's so common, the odds are that female GP has experienced similar themselves. And it's, it is a side effect of contraception that isn't talked about a lot, which we should be bringing up more often, alongside the bleeding and the potential mood changes and the risks.
And one of the things would be interesting to know. So when you think about it, it was interesting that you said, I'm from the era, you take the pill for 3 weeks, off for a week. Now, you can be on contraception, for about easily for 35 years. I mean, yes, you may have a break if you decide to have children. And then, but there's no sort of thing, or I don't think there is, where people ask you to come and discuss and review what you might be on. So I could potentially, for example, I think I probably was on the same pill, or one could be on the same pill all the way through, and you don't know whether your body may have changed, where actually this isn't the best thing for you. So how often would you suggest that people go to their doctor to say, well, actually, I'd like to have a review?
Well, so firstly, if you are on combined contraception, so the pill, the patch, or the ring, you should be having a review every 12 months. And that's really important for a blood pressure check, and to check your weight and height, and to check that none of your history, your medical history or risk factors for those risks we talked about earlier have changed. So if you haven't had a review within 12 months, you really should be getting in touch with your doctors to get one. The difficulty is the way that the healthcare and primary care in particular is working now. A lot of those pill checks have been moved from GPs themselves to even healthcare assistants, who are absolutely fantastic at what they do, but haven't had the training in contraception that I have. So you'll go in, you'll have your blood pressure checked, you'll have your weight and height checked, but there isn't often the opportunity to discuss the side effects or discuss things that may have changed. So while we don't have any strict criteria that you have to have a discussion with your doctor, if you feel like you need one, book one. We are here to talk about it, either with ourselves or your sexual health clinic. You can stay on the same contraception for your entire reproductive life, especially the really safe ones like the progesterone only pill, the implants, the hormonal coil, the copper coil. there is no reason for you to have to switch, unless you feel like you want to or it is affecting you. I have some women come to me and say, I'm 35, I have to come off the pill. And I say, why? Because I'm 35. And actually, they have had a fantastic time on the pill. They have no side effects whatsoever. It's helping their PMS, it's helping their skin. But for some reason, they think they have to change and they don't. But if you have a problem, definitely come and speak to us and think about a switch.
No, that's really useful to know. So talking about that, the word switch, I know that's one of the things that you were very keen to discuss. Is, you suddenly decide, well, actually, this isn't working for me now. And it could be just the medication's fine, but it's the method in which it's delivered that you want to change. So how do you go about switching?
Yeah, I think a really good example of that is having children. So when you're waking up at however many times a night, like I am at the moment, how can you remember to take a pill every morning? And so women often think, I just need something that I cannot think about. And so that's a really common time when women think about a switch. If you are thinking about a switch, it's often more complicated than just stopping one and starting another. And so it does really need to be done under the supervision of a healthcare professional. One of the riskiest times for unplanned pregnancy could be when you're switching from one method to the other. And if you're not covered for even a few days in between, you could release an egg and then end up getting pregnant. So switching can be a little bit complicated, especially if you are using combined contraception like the pill patch or the ring. It depends where you are in the packet, if you've had a break, if you've had sex recently. All of these factors can affect how effective your contraception will be when you change. So make sure you speak to a healthcare professional. And if you still aren't sure, on the lowdown, we've just created a table where you can look and check to make sure that you're covered and what to do to make sure you're covered against pregnancy.
And I think it's really important when you go and seek advice or you look up things on the internet, particularly over something that is so important and can be life-changing if you suddenly become pregnant when you didn't want to be. I mean, it can be obviously devastating for lots of people for many reasons, that you don't just go on to a forum and just say, well, this is what happened because I found this one worked for me. It's so important that you go to places like, the Lowdown, for example, or you speak to your GP to really get the medical facts about it, as opposed to hearsay what worked for other people.
Yeah, exactly. So I see Facebook groups giving out medical advice, which it just isn't correct. Mumsnet is fantastic for lots of things, but medical advice, it definitely isn't. So I'd recommend if you're reading about things, and I always think keep yourself educated, check to see whether that information has been medically reviewed by someone. And it will often say at the top of an article or the bottom, if a doctor has medically reviewed the article to make sure the information is correct. There are lots of really good resources out there. Just make sure you find one of them. The Lowdown is a good example of one where we're sort of trying to bridge the gap, because we do have all the medically reviewed correct information on our blog pages, but we also invite women to share their experiences. What we don't have is women telling other women what to do. We have medical advice and women sharing their experiences to help women understand things and understand how it might affect them, but not to tell them what to do or advise them medically.
I think that's very much where we are at Talk Health, is that we're very happy to share members' story, but it's sharing their story and their experience, but not saying if you do this. The other thing that we at Talk Health, we're something called PIF ticked, which authorised, which means Patient Information Forum, which means that everything that has one of these little logos means that it's been through evidence-based. So it's been written by a doctor and it's been peer reviewed and all of those usual things. And it's, definitely the health industry is trying to push any authoritative site that produces health information has this PIF tick against it, so people can know if they're looking for health information and it hasn't got either this pivotal authorization or lists where it gets all its evidence from,
Yeah,
run away from it, I think.
yeah, it's very important because we've seen, you know, over the pandemic and how quickly fake news can spread and how it can really impact people's decision making. So we have to make sure that the information people receive is the right information to make their decision.
Yeah, absolutely. One of the other things that we've also been looking at, and we've done some survey work, is how contraception. So generally, you get it free from the doctors, but you can get it under private prescription. But now the great news is that you can get it from a pharmacist. But you know, I know there's definitely people have slightly mixed reviews, probably depending on the age, where they've always got it from a doctor and now, oh my goodness, would a pharmacist know my background? What do you feel about contraception from a pharmacy?
I personally think it's an absolutely fantastic move if it's done correctly. That's because I'm really passionate that it needs to be easier to access contraception than it is to get pregnant. And we all know how easy it could be to get pregnant for some women. But there are sometimes barriers up to accessing your contraception, whether that's, you know, being 54th in the queue to your GP reception that morning, whether it's the fact that the next appointment for coil fitting is in 5 months' time. There are barriers to access. So having this alternative and extra way to get some contraception, I think, is brilliant. You can be reassured that the progestogen only pill is very safe for most women. And the pharmacists are trained and have a strict criteria of who they can sell it to. But what I want to make sure is that women still understand what they're getting themselves into in terms of side effects. So unpredictable bleeding, possible acne, possible mood change. So as long as women are receiving that information as well, I think it's a great idea.
And maybe if you know what you're on as well, you've been on previously because the doctor suggested it, makes it easier as well, isn't it?
Yeah, so the progesterone only pill, which you get from your doctors, would usually be called desogestrel, sometimes Cerazette. The one that is available from the pharmacy is either Hana or Levima. I think it's Levima. But they contain exactly the same hormone. So you can switch between those seamlessly as long as you don't miss any days, without any problem.
No, I mean, it is fascinating, and it seems ridiculous that it's taken such a long time to do this easier access. So now is roughly the time that we ask people to, if they've got any questions. So if you've got any questions, please do let us know. But people have put questions in, so I do have some questions already from that.
On the spot.
Well, I don't think. Well, I was going to say. I mean, as I say, I don't think you'll find them difficult. But who am I to know? But I have no idea. So, what's the best contraception for an 18-year-old girl who doesn't want the pill? Who doesn't want the pill? The family has trouble with the implant. I'm not quite sure I understand that.
So I can't give out individual medical advice, but if you're not happy with the pill and you're not happy with the implant, other options, the injection is very well tolerated with younger women. The only thing you have to consider with the injection is if there's a family history of osteoporosis or any other problems that could make your 18-year-old daughter, I'm assuming it's daughter, 18-year-old girl, more prone to thinning of the bones or osteoporosis, because there is some evidence that the injection can thin the bones slightly. The injection is one of the contraceptives which is more likely to cause weight gain, but that is more common if a woman is already overweight or obese. So if a woman is healthy weight, I would suggest trying the injection because it's less likely to cause weight gain. And finally, the injection can, in some women, delay your return to fertility for up to 12 months. Not every woman and not always 12 months. but it's something to consider if you're nearing the point in your life where you want to start thinking about having a child. So 18, have a chat about the injection. I think that's a really good choice. And the other thing to say is, when you say the pill, what does the pill mean? Does that mean all combined pills? Does it mean one brand of the combined pill? Does it mean you've tried the progestogen only pill? Because they are options as well. If one brand hasn't suited you, go back and speak to a GP about switching to a different one, because the different types of hormones may improve things. And at 18, it is possible to have a coil fitted, not a problem. It just might be a little bit more difficult because you won't have had, well, I say won't have had, there are plenty of 18-year-olds who have had children, but you're less likely to have had children. So it's sometimes a little bit more difficult to fit a coil, but that doesn't mean you can't have one. So first thing I would say is look more into the pill and why in particular you don't think you can have the pill, injection, or then coil.
Brilliant, thank you. Then completely the other spectrum, and something that's really important that we didn't really cover is contraception for the over 50s. So somebody's asked, what is the best contraception for the over 50s? And I think that, you know, lots of people think, oh, 40, that's it, you know, doesn't matter, I'm not going to have,
Yeah, no, you need contraception until your fertility, your reproductive life has come to a natural end, which is when you've stopped having periods for 12 months or more. So I am a huge fan of the hormonal coil in women around the perimenopausal age, because of what we touched on earlier, that it can also be then used to treat the heavy periods that can happen with perimenopause, and can then be used as part of your HRT if you choose to have some treatment through the menopause. So over 50, the hormonal coil is an excellent option. So please have a real read of everything about it. And other than that, there is no form of contraception which is completely off limits to you. It's always decided on a case-by-case individual discussion. If you are over 50, completely fit and well, no medical problems, you don't smoke, you're a healthy weight, after discussion, you could still even have the combined pill, you can have the progestogen only pill, you could have the injection, you can have the implant. So it's worth having a look at the hormonal coil, seeing how you feel about that. If you don't like the idea of it, then have an individual discussion with your healthcare professional based on you and your medical problems, because anything else is still open to you.
All right. Your world's your oyster at 50.
It is. It's a misconception. It depends very much on the individual, but just because you're older doesn't mean that you still don't have individual choice.
Okay. I have just actually, I need to put my glasses on. I don't know why I'm pretending I can read without my glasses, to be honest. I've just started taking the combined pill to help my PMS, which has really helped. I'm 2 months in and taking the pill back to back, and I've been told to take a 4-day break when I have a breakthrough bleed. When will this happen, or when will this likely happen? Is it 3, 6 months, or never? If it's never, is it fine to continue taking the pill back to back?
Yes, excellent. Removing the break with the combined pill earlier, it's completely safe to do, and as you've described, it's a really excellent way to control those PMS symptoms. So I always talk about a rule of 4, and I say if you have 4 days of annoying breakthrough bleeding, have a 4-day break, because it's easier for women to remember 4 and 4. However, there is no way of knowing how often that will occur for each individual woman. Sometimes I can get an idea. So if you're someone who's had very heavy periods in the past, you might have more breakthrough bleeding, more often needing to take a 4-day break because your womb lining may be thicker. If you've always had very light periods, or you've recently been on a different type of contraception, such as the injection or the implant, or been on the pill but taken in a different way, that could already have thinned your womb lining out quite a lot. So you don't have much lining there to shed or cause a breakthrough bleed. So you might find, if that's the case, that you rarely need to have a 4-day break. And if you don't have one, of course, you can keep taking the pill continuously back to back without a break for as long as you want to. And it's important for you to know why, I think. The reason you can do that is because the estrogen in the combined pill is there to stop you ovulating and to prevent you getting pregnant. The progestogen, that thickens your cervical mucus to stop sperm getting inside, but it also thins out the womb lining. And that's the important part of the safety of it, because estrogen can cause your womb lining to thicken, but the progestogen is counteracting that to thin out the womb lining. So it's completely safe to not have a bleed as long as you have both of those together, the estrogen and the progestogen. I hope that makes sense.
Yeah. And it's sort of, that relates also with HRT, doesn't it?
Exactly. It's a very similar concept.
Right. Well, I've run out of questions now, and we haven't had any more. I mean, I don't, what, you know, to ask you, what is you know, what's the most common question do you get asked? I mean, is there a set of common questions that you get asked all the time that we possibly haven't covered?
And to be honest, I think we've covered most of them because I get asked them so commonly. I have talked about them. And I think because I do a lot of contraception consultations for the lowdown, and I think the top ones I get are concerns about risk, definitely blood clot risk, mood and libido changes, and bleeding problems. And I think we've touched on each of those, I hope. But yeah, there's a lot of myths with contraception. I hope I've managed to bust some of the myths today.
But I think it's also like with so many conditions that we talk about. If you're not happy with what you're on, don't accept the status quo. Go back and because there are so many combinations, aren't there? As you've said, there's a good chance that there is going to be something that will suit your body better than something else.
Yes, and we have really, really quite complex ladies coming and talking, and we can almost always find a method which they may not be completely happy with, but they have been able to weigh up all the information and make a choice and a judgment for themselves. And that's what it's all about. It's feeling happy and empowered with your decision as well.
And I think one of the things that you said was really important. If you understand what the side effects are, you know that this is happening, and you know that it's, you know, lots of other people have those things. It's much easier to cope with and to accept than you know how to manage it, isn't it? But sitting there not knowing whether this is right or not, you just end up getting worried, and it's all of those things. So there's no need to, because we've got such a great infrastructure in this country for seeking advice in many different ways for this.
Yeah. Just
Oh.
always can ask. We're always happy to talk.
Oh, well, thank you so much, Fran, for coming to speak with us, to educate us. And I know that this will be a very popular, resource for people, for so many people to share also with, their family members, for sure.
I hope so.
Definitely. And I'm very glad we did. Well, I'm sorry we didn't see your daughter, but, I'm glad we also didn't see her.
Yeah. Oh, I'm sure she'll be missing me. But thank you so much for having me and for inviting me on this.
No, it's great. And thank you.
Not a problem. Anytime. I just hope that some people have taken some positive things from it.
I'm sure they will do. Thanks much. Thanks, everyone. Bye.
Bye-bye.